Oxford Dictionary defines deception as deliberately causing someone to believe something that is not true. This is an important aspect in psychological experiments and has been used throughout the history of psychology.
Deception is necessary because it allows participants to engage in a research study without behaving in an unnatural way. When conducting psychological research, it is important that participants behave the way they normally would if not being observed or studied. It is important that participants behave in a natural manner in order to ensure validity of the experiment, namely by preventing demand characteristics from affecting the study. Weber and Cook have described some of these demand characteristics as involving the participant taking on a role in the experiment. These roles include the good participant role, where the participant attempts to guess and confirm the experimenter's hypothesis as they do not want to ruin the experiment. The negative participant role, aka the screw you effect, where the participant attempts to guess and confirm the experimenter's hypothesis in order to destroy the credibility of the study. The faithful participant role, where the participant follows all specific instructions given by the instructor. The apprehensive participant role, where participant behaves in a socially desirable way.
It is hard to pinpoint the exact time in which deception was first used in psychology. Deception emerged organically during the development of experimental psychology during the 19th century.
One of the first deception experiments was conducted in 1929 by a student of Kurt Lewin named Tamara Dembo, who was interested in studying the causes of anger. She assigned participants to perform a task that lacked an actual solution. After her experiment, Lewin was inspired to publish more work on the usefulness of deception. Despite Lewin and Dembo's initial endeavor in deception, purposeful deception was not commonly used until the 1950s, when it began to rapidly increase into the 1970s.
In light of World War II, the Stanley Milgram experiment was created to explore the willingness of people to inflict harm on another individual while an authority figure instructed them to continue. Participants were instructed to teach word pairs to learners, but upon incorrect answers, the learner was punished with increasing voltages of shocks. The participants were deceived into believing that the shocks were actually being delivered, when in fact there were no shocks. Shockingly, all 40 participants obeyed and administered shocks up to 300 volts, and even more shockingly, 25 out of the 40 gave the maximum shock of 450 volts.
That could kill a man!
Even though participants were debriefed, this experiment brought into question the ethics of the use of deception. Milgram argued that deception is used when necessary in order to set the stage for the revelation of certain difficult-to-get-at truths.
This elevated the platform for the debate of whether deception is good or bad.
As important as deception is in allowing psychologists to achieve significant and beneficial findings, there are a few historical instances where it was abused. One infamous study, the Tuskegee syphilis experiment, which began in 1932, is well known for its unethical practices and deception with regards to medicine. Participants in the study were not told they had syphilis and were informed they had a bad blood condition in which free medication would be administered by the government. Participants were given free meals, healthcare, and burial insurance for their participation, which lasted a span of 40 years. As a result to lack of proper treatment for syphilis, which was the administration of penicillin, numerous participants eventually died, often after spreading the infection to partners and having children born with the infection as well. The study used deception by informing participants they were receiving adequate treatment when they were not, in order to create an environment in which physicians could study patterns of African American sexuality in a controlled setting. Of course, the rewards of these findings were far outweighed by the consequences of medical malpractice and numerous ethical violations.
Although the use of deception has certainly not been without controversy, it has allowed psychologists to study phenomena that would otherwise be impossible, and many of these studies have given us important insight into human behavior.
One such experiment was conducted after the murder of Kitty Genovese in 1964. Her murder raised questions about whether the old adage of safety in numbers was really true. Although Kitty's murder was witnessed by many bystanders, no one called the police in time to prevent her death. This led experimenters Darley and Latané to devise an experiment to test their theory of the bystander effect, or the idea that when multiple people witness the same event, most will assume that it is the responsibility of someone else to take action, and not their own. Their experiment involved putting participants into a room by themselves and instructing them to have a conversation with other participants, whom they couldn't see, but could still hear. What the participants didn't know was that all of the other participants were simply recorded voices. One of the false participants began to have a seizure in the middle of their conversation with the real participant. Darley and Latané's results showed evidence for the bystander effect. If their participants believed to be in a conversation with multiple people, only 31% tried to get help for the participants seemingly having a stroke, while 85% of the participants who believed they were having a one-on-one discussion with the sufferer of the stroke tried to get help. Thanks to their experiment and use of deception, we now know important information regarding how you should seek help if you are ever in an emergency situation, and we can educate people about the bystander effect so that they can avoid being a part of it.
The importance of deception in psychology is acknowledged by APA Section 8.07 of the manual, Deception in Research, which provides guidelines for ethical deception and states that psychologists do not conduct a study involving deception unless they have determined that the use of deception techniques is justified by the study's significant prospective scientific, educational, or applied value, and that effective non-deception alternative procedures are not feasible. Psychologists do not deceive prospective participants about research that is reasonably expected to cause physical pain or severe emotional distress. Psychologists explain any deception that is an integral feature of the design and conduct of an experiment to participants as early as is feasible, preferably at the conclusion of their participation, but no later than at the conclusion of the data collection, and permit participants to withdraw their data. If deception is used, it is important that the participants are properly debriefed and that the debriefing takes place as soon as possible after the data collection. APA states that psychologists must provide a prompt opportunity for participants to obtain appropriate information about the nature, results, and conclusions of the research.
In conclusion, deception is no doubt considered a very important puzzle piece within the vast discipline of psychology.
Even though deception is necessary in order to ensure proper validity within an experiment, it has been highly debated. Deception within experiments must be conducted correctly, meaning in the most ethical manner in accordance with APA, in order to ensure participants don't experience extreme levels of emotional or physical stress. Experiments like the innocent bystander study are positive reinforcers to the importance of deception in furthering psychological research.